Thank you for joining How to Effectively Market Your In-Office Vascular Testing Device. We will be starting shortly. We will wait a few more minutes for others to join us. Thank you for joining How to Effectively Market Your In-Office Vascular Testing Device. We will be starting shortly. We will wait a few more minutes for others to join us. Thank you for joining How to Effectively Market Your In-Office Vascular Testing Device. We will be starting shortly. We will wait a few more minutes for others to join us. Thank you for joining the BioMedix How to Effectively Market Your In-Office Vascular Testing Device webinar. My name is Lindsay King, Marketing Coordinator at BioMedix, the sponsor of this webinar. Our speaker today is Lindsay Tenzing, Marketing Communication Manager at BioMedix. Lindsay Tenzing is an experienced marketing professional who honed her skills in the medical aesthetic industry before joining BioMedix 3 years ago. Lindsay has written articles about promoting practice services and recently gave a lecture on the importance of educating patients about PAD and in-office vascular testing. We have 3 housekeeping notes. 1, if you have questions, please type them in the question box to your right. We will have time at the end of the webinar to answer some of your questions. 2, there will be survey questions at the close of the webinar. Please take the time to answer them. We appreciate your feedback and it will help shape future webinars. 3, after the webinar, if you have any questions that have not been answered, you can email info, I-N-F-O, @biomedix.com. At this time, I would like to introduce Lindsay Tenzing.
Thank you, Lindsay, and welcome everyone. Good afternoon to those of us on Central Time or Eastern Time, and good morning to those who are on the West Coast. Thank you very much for taking the time to discuss with me today and join our webinar about how to creatively market your PADnet and in-office vascular testing devices. What I'd like to start with is a poll to see how many clients we have actually on our webinar today. So if we could start that poll, Lindsay, if you can assist with that, please. We're going to take a look at how many of you actually have a PADnet today. So if you can just take maybe 10-15 seconds, choose yes or no. We've got a fairly small group on today, so it'll go fairly fast. Excellent. If we can see those results. Okay. Great. So we've got about 86% of you are current PADnet clients. For the others who are not necessarily a PADnet client, this is great information for you to have to check with your manufacturer and provider to see if they offer some of these same tools, as well as access some of the tools that are available to you and free through the other organizations we work with, the PAD Coalition, the Venous Disease Foundation, etc. So what I'd like to start with is, let's talk about what is PAD. Peripheral vascular disease and peripheral artery disease affects 8 to 12 million Americans today, and that number is growing. Nearly 1 out of 3 people over the age of 70 have PAD, and without proper treatment, 30% are likely to die within 5 years. These numbers are astounding, and they are growing. So who's at risk for PAD? All patients over 65 years or older, patients who are 50 years or older with a history of diabetes, high blood pressure, high cholesterol, a habit of smoking, patients who experience foot, calf, buttock, hip, or thigh discomfort when walking that is also relieved by stress, patients who experience pain when they're at rest in the lower legs or feet, those who experience foot or toe pain, disturbances when sleeping, patients whose toes and feet are pale, discolored, or bluish, who have skin wounds, ulcers, who have diminished or absent foot pulses, pedal pulses, patients who have suffered a severe injury to the legs or feet, and patients who have an infection in the legs or feet that may be gangrenous, wounds that aren't healing. These are all risks that physicians see on a daily basis, and it's important for them to take a look and think, is this something more than just this particular wound? So critical facts, one of the groups we mentioned at risk are diabetics. 25.8 million people, or 8.3% of people in the U.S., have diabetes. Diagnosed today, 18.8 million people. Undiagnosed, an estimated 7 million people. Astounding, again, the numbers of people who are affected by this disease. The estimated total cost of diabetes is likely to exceed $200 billion annually, and is projected to rise to $500 billion by the year 2020. It's important for us to be cognizant of these numbers, be cognizant of the risk factors, so we can help to reduce this disparity. Comprehensive foot care programs can help reduce amputation rates by 45 to 85%. And this number comes from the Centers of Disease Control and Prevention. So risk factors include, this includes risk assessment, foot care education, preventative therapy, treatment for foot problems, and referral to specialists. Again, developing that collaborative care program with other physicians to have a complete care solution. So why is P.A.D. a growing problem today? Well, one, it's the most prevalent morbid and mortal vascular disease out there. The cost of P.A.D. is high and likely higher than any other vascular disease out there. Payers now obstruct access to the most accurate, safe, and cost-effective diagnostic test, which is the ABI, or the ankle brachial index. It's the most underdiagnosed and undertreated of the cardiovascular diseases, and the risk is highest amongst African Americans, and nevertheless, the public is unaware of what is PAD. People don't understand what it is, what the signs and symptoms are, what risk factors they are, if they're at risk for it, and it's extremely important that we are building that awareness within our communities. 3 out of 4 adults surveyed have no idea what PAD is. This is scary. Just to think that there was a survey done, basic question, how familiar are you with PAD? Possible answers, very familiar, somewhat familiar, not too familiar, not at all familiar. Almost 75% of people don't know what PAD is. And it's important that we are educating our patients, we're educating families, we're educating friends as to what PAD is, because it is such a deadly disease. The physician's role in PAD, because you are exposed to patients every day, exposed to the risk factors every day, you have the ability to catch this early. Being part of the collaborative care engagement will improve the quality of care, reduce morbidity, mitigate risk, and it's also a potential revenue stream. So how do we do that? It's important that you have marketing, you're marketing your services as well as your technology. So I'd like to do another poll to see how many of you have a marketing kit with your technology. Again, if you could just hit yes or no, we'll just take a few minutes to take a look at, have you guys answer this, and we'll take a look at the answers. Okay, 60% of you do not have a marketing kit with your technology. That's very interesting. So then my next question would be, of those who have it, do you know how to access it online? And if, Lindsay, if you can assist me getting to the next poll. So for those of you who are PADnet customers and have the marketing kit, do you also know how to access this marketing kit online? We'll just take a few seconds to answer that poll, just yes or no. Okay, 75% of you are unaware of how to access this online. This is great. This is why we're here today. We can go over how to market your products, your services, as well as how to access these tools online. Some of these items are specific to PADnet, but there are several tools that are provided by the PAD Coalition and the Venous Disease Foundation. So with our marketing kit, it's a complete turnkey marketing solution. We include a comprehensive how-to guide that takes you step-by-step through these tools, how to use them, how to customize them. We also added recently a women-centric marketing module in honor of Women's Health Month. So the marketing launch kit tools has an interactive launch kit guide for physician practices. This can be accessed online if you go to www.biomedix.com, the login directory, and then from there you go into your medical professional resources. I'll get into further detail about what's on there, but that's where this information can be accessed. There's an interactive guide as well as a PDF online. And for those of you who may have lost your CDs, please email info@biomedix.com and we'll get you replacements sent out to you. So within this guide, there are educational materials provided by the PAD Coalition as well as the Venous Disease Foundations for PAD and CVI patients. Here's an example, screenshots for those of you who have access to the website, the login directory, customer employee login. From there, you will go into the landing page for medical professional resources, and this is where you'll find all sorts of information on the website. Everything from your manuals and guides, your marketing materials, your patient education materials, forms, reimbursement information, how to contact support and customer service, as well as where to purchase your patient education materials or ancillary products that you may have from BioMedix. So let's get into the meat and potatoes of what's in this marketing kit. There's a ton of tools ready for customization for you. Either you can work with a designer, a place like FedEx Kinko's that can help customize items, or you may have an in-house designer or person who is familiar with using Word, PowerPoint, and other design programs such as Quark, InDesign, Photoshop, etc. So the first item we have is the ready-to-use letter templates. These patient letters help build practice, knowledge, loyalty, build your program. We also have referring physician letters to help build your collaborative practice, bringing you in touch with the specialists who can help read your tests as well as go on for further treatment and intervention if needed, hopefully not needed. We have byline article templates that talk about arterial leg pain. This makes it easy for a practice to make any submission to a local newspaper or local magazine. People in the news industry love a local story. So it's a national cause with a local story, and news stations, magazines, press, they'll eat this stuff up. So this is already ready for you. All you have to do is take the content, put it on your letterhead, add your contact information on it, and send it on. PAD article templates. This is the first of the PAD Coalition materials that are free at padcoalition.org. This particular piece will promote your practice, raise awareness for the service within your network and market, and it provides that educational content specifically from an authority, so the PAD Coalition, on what is PAD and who's affected. We have a newsletter template also by the PAD Coalition in their efforts in their Stay in Circulation program, which is an outreach program to patients and families and friends. This particular customizable newsletter is good for articles and emails. It promotes your practice. Again, it works within your market to provide screenings if your organization does so. And it lets prospective patients know about the services that you're providing, especially as organizations such as the PAD Coalition and the VDF are trying to build that patient awareness about PAD and CVI. People are starting to learn about it, and it's important that they know that your particular office is offering this service. There are also sample phone scripts. The phone script samples are for medical office, talks about PAD. It gives a description of it, what are the risk factors, and what are the treatment options. Because your front office staff is the first line of communication to your patients, it's important for them to have this information so they understand and how to speak to your patients about PAD and the risk factors. We provided in our marketing kit Arterial Ad Templates. These are completely customizable templates to promote your practice, again, working within your market and letting prospective patients know that you provide this service. These particular templates are in a format such that you would want to work with either a designer or a place like Kinko's to help customize and put your logo on there and your contact information on there so patients know how to get to you. There's different sizes, which enables you to have placements in newspapers or publications, or even convert this to a banner ad placement to put on your website. The PAD questionnaire is an important questionnaire because this helps for patient self-selection. They're able to take a look at these questions, answer the questions, and help them determine, is this something that I need to discuss with my physician? Patients can request more information in the office. And we also have a Spanish translation on the back side of it, also available on our BioMedix website under the medical professional resources, is this particular questionnaire in Chinese and in Russian. Additional patient education materials provided by the PAD Coalition with their Stay in Circulation program are these life-saving tips. So this provides information to your patients, their family, their caregivers, and helps guide the conversation to PAD risk factors and evaluation. There are several different life-saving tips with PAD that, again, is on the padcoalition.org website. PAD Coalition also put together new this year in collaboration with the VDF, a public service announcement. PSAs are unpaid advertisements used to call attention to the issue. You can use this in publications, you can use this in your newsletter, you can use this in your own e-blast if your organization does that. Again, these are great tools that are free to you through the PAD Coalition and the VDF. Radio PSA scripts. Within our particular marketing kit, there's an article about the blueprint to successful radio advertising. This is an article that I wrote and published within Vane magazine that talks about choosing your particular audience, making sure your message is correct, making sure the demographic is correct, working with a radio station to ensure that your message gets out at the correct time. There's scripts also in our marketing kit for 15, 30, and 60-second spots, and it's important to make sure the listener knows who you are, what you do, and how to contact you. All of this information is in the marketing kit, and it's a great resource for you to use. Patient exam brochures. One of the most popular marketing pieces that we have still today is the patient education brochures. We have P.A.D. exam brochures for patient education, CVI, and the women-centric highlighting heart health. These can all be customized with your practice logo, your practice information. You can either download off of the website and print out directly from your practice. You can take the file into a place like Kinko's to have them customize it, or you can purchase these online on our online store. These are great tools to have within your practice, in your waiting room, even in your exam rooms while patients are waiting. A lot of times they'll pick up the pamphlets that are sitting there, and they can learn about the different risk factors and learn about the disease state of PAD and CVI. The women-centric P.A.D. exam brochure is educational content specific to women. It highlights the steps to take in protecting heart health, as well as educational content provided by the national coalitions. This was the piece that we had developed in direct correlation to promote women's health and women's heart health. The Venous or CVI launch tools that we have also include ad templates, letters for physicians and patients, letters of introduction with women-centric focus to be used with an OBGYN vein center or plastic surgeons, patient education brochures, and presentations, all customizable with your logo, your contact information. Here's the CVI article template that we have available for you. Again, making it easy for the practice to make a submission to a local newspaper, local magazine. It can be used for your newsletters or your e-blast, and it lets professionals know that you're a provider of CVI testing. You can post this on your website along with any of the images that you receive in the marketing kit from us, or hopefully if you don't have a PADnet, with your provider provides you images to post online. The Venous Direct Mail template is an easy, customizable, pre-designed postcard that has messaging specific to women about venous testing. This, again, is customizable, easy to use, bring to Kinko's, use with your local marketing groups who you may already have relationships built with. Just another easy template. This particular direct mail piece is for referring physicians, and it encourages professional networks to collaborate to build a collaborative care network for CVI. Here, ad templates, we saw earlier ad templates that were specific to PAD, and this is a series that we've developed within our marketing kit specific to CVI. Again, this is great for newspapers, magazines, websites, easy to customize, it works within your market, and again, encourages that education to patients and staff and families to let prospective patients know that you are providing this service. The CVI Exam Patient Brochure speaks directly to CVI patients or people who are concerned that they may have CVI. It's educational content from the Venous Disease Coalition and the P.A.D Coalition to familiarize your patients with your venous testing services. The CVI Patient Questionnaire is very similar to the P.A.D questionnaire in that it helps with patient self-selection. This starts the conversation to ask the patient asks for more information, and it helps guide the conversation to vascular complication risk and evaluation. We also have the Spanish side on the original version. We also have available online Chinese and Russian. One of the other tools that BioMedix offers that I really encourage anybody who has a vascular testing system to check with their manufacturer is a location finder. This is free advertising for our customers to advertise to other physicians as well as to patients that they're offering this service. Our particular website features a listing of hospitals and doctors who are using the BioMedix technology. It's for current clients only, but you can choose anything from state to zip code and find a physician or a hospital in your area that offers the services. If you are a current client and you haven't signed up for this program, I encourage you to go to this page on the location finder and click on the online provider sign up and sign up for this free service. You will be listed exactly as you enter in the information. And once you submit within 72 hours, you will be posted on the website, of course excluding weekends and holidays. Additional marketing kit CDs that we offer to our clients include web quality images, print quality images, and patient education PowerPoints, which enable any physician office to have a loop about the risk factors of CVI or PAD in their office. That's a great forum for patients and their families to understand the services that you're providing, and it triggers them to ask the questions of the physician or the nurse or technician to see if this is something that they may be a candidate for. Again, if you're a current client of ours and you have misplaced your CDs or your marketing kit, please email info@biomedix.com and we'll be sure to get you replacement discs out. Now, along with the marketing of your PADnet, the big topic right now is electronic health records and practice management software. It's the buzzword. Patients are starting to learn about it, but they're not really understanding it. It's important for you to utilize an EHR or a practice management system to track the PAD and CVI risk factors such as diabetes, cardiovascular disease, smoking, age, cholesterol, hypertension, and be able to create a clinical decision rule within your software to see if this is a candidate for PAD or CVI. Because of these changes we have with everyone, well, I shouldn't say everyone, but the majority of people moving over to EHR and practice management software, is educating clients again on why you're doing this. It answers questions about why you're going to it, the importance of it, and how it benefits not just your office, but how it benefits the actual patient. These tools are also available to you online that you can print and use in your office. Diagnosis of PAD and CVI really starts with education. It's educating the patients, it's educating the families, and it's important that we are sending that message out there. Diagnosis of PAD starts with surveillance, and it starts with you. I'd like to take this moment to answer any questions you may have about the marketing kit that we have, the resources on the P.A.D Coalition website. or even the VDF, and I can try to answer some of those if available. So if you have any questions, please go ahead and type those in the question box. Again, for replacement discs, it's info@biomedix.com, and we'll get you replacement discs out if you give your first and last name, your address, and your phone number. The PAD Coalition and the VDF state in circulation materials are at padcoalition.org. And again, for those of you who may not have a PADnet device, I would encourage you to check with your manufacturer, your vascular testing vendor, to see if they have any of these tools available to you. Again, if you have a question, please go ahead and type it into the question box. One question I have from one of you out there is, one of the screens says payers are obstructing access to testing. A lot of, I shouldn't say a lot, but there have been several groups who have been trying to change how testing is done for PAD. The ACC just came out with their updated guidelines, which does say that ABI is important for PAD testing. And some LCDs out there are saying that this isn't a valid test. So some people are not allowing physician practices to be able to offer these services, and that's where that statement comes from. For those of you who may have more reimbursement questions, I would recommend contacting Linda Doran at LDORAN@biomedix.com. She is our reimbursement specialist, and she would be happy to assist you with any of your questions. Do I have any other questions? Okay, then I'd just like to thank you again for your time. If you need anything else, please email info@biomedix.com, and have a wonderful day.
Thank you to Lindsay Tenzing and all the attendees who joined us for how to effectively market your in-office vascular testing device. This concludes our 2011 webinar series. Look for our first 2012 webinar in January. To stay current and keep up with our upcoming webinars and trade shows, visit the events page at www.biomedix.com. Lastly, please remember to fill out the short survey. Your feedback is very much appreciated. Thank you. We are adjourned.